Hello, Uganda. Mwanguzi Shadrach from Health Touch Uganda. There are people who usually get chest pain, and it's actually very common in our settings, to the point that people now know. There are people you find and they tell you, I usually get chest pain, and all they do is to get a painkiller, suppress it, and that day goes. But I want to tell you that chest pain can be very dangerous. It can take your life without a warning. So it's very important for you to know that there are different causes of chest pain. You may not be able to know what has caused your chest pain at that particular moment, but you are supposed to go and seek for medical advice every time you get that chest pain. Today I'll be telling you that there are different organs in the chest. This is the chest I'm talking about. Then around here, up to here, chest. Then from here, up to here, it's the abdomen. So, this chest has different organs in it. And they are all very, very important and vital organs in your body, to the point that without them, you can't live even for a day. One of them is the heart. The heart plays a very important role in sending that blood to the different parts of the body. We also have the lungs in our chests. They are like air bags or air sacs, air bags. One here, one here. So those lungs also play a very important role. When you breathe in your air, they pick out the air that you need and send out the one that you don't need. So they are also very important. So an illness to any of those organs, to the heart, to the lungs, can cause chest pain. There are also bones, these ribs and the bones of the back. There are also muscles. So something that affects any of those things can also cause chest pain. The abdomen, this lower part, also has organs in it. Sometimes a problem of one of them can cause pain in the chest up this way. So that means a problem in one of these organs can also cause chest pain. So you realize there are actually very many causes of chest pain. That's why you're not supposed to sit at home just because you have a simple chest pain or an occasional chest pain, or because your neighbor also has the same problem and they are there. That is usually something that is very misleading, because you meet someone and they tell, I also have the same, but I use this kind of medication and I live on. That is not good. You're supposed to go to a health facility and they find out, because some of the damages that may come may not be sudden or may not be big enough to cause sudden death and very big complications, but that progressive damage caused is the one that may cause a problem at the end of the day. Some people feel chest pain on one side of the chest. Others feel generalized kind of chest pain. Others feel the pain here at the center, in the middle of the chest. And this sometimes can also be felt in the back or in the shoulder or on the jaw. So that also is very, very, very dangerous. It's very dangerous. You're supposed to go to a health facility, because it can be a sign that probably your heart is under stress and it needs urgent help. That's how the heart communicates that, you know what, I really need urgent help. It makes noise for itself, but for you, all you do is getting a simple painkiller. If you're someone that has high blood pressure, you're someone that has diabetes, every kind of chest pain, please run. If you have high blood pressure and other kind of diseases of the blood vessels, please run very fast. For the diabetic people, you may actually not at sometimes feel the chest pain even when there is something so urgent, but any slight kind of chest pain you feel, please run. Some of you feel a lot of pain to the point that you are not even able to breathe. So I will actually tell you some of the things that when they happen in conjunction with your chest pain, you should actually run very fast. 1, you have difficulty in breathing. Every time you try to breathe, you feel a lot of pain. Every time you try to breathe, you feel a lot of pain. Or it may not be pain, but the difficulty in breathing itself. You're air hungry. Or when you lie down, you face difficulties in breathing. Sometimes you even wake up in the middle of the night and you can't breathe so well, or you have to really sit up for you to breathe normally. All those things may be indicators that you need urgent attention. When you cough out blood, you have been coughing for so long, all those things in conjunction with your chest pain should take you to hospital. So my emphasis is, let's not take chest pain as something that is very light, because it has costed lives of many. So before you know what the cause of your chest pain is, please don't settle until it has been fully established and you've been given expert advice from a professional health worker. Mwanguzi Shadrack, Health Touch Uganda, follow the light.